I'm Ali, I'm one of the physios from sportsinjuryphysio.com, and I'm currently doing a series of these videos on lateral hip pain. Lateral also means outside hip pain, and around that area it's called the greater trochanteric pain syndrome. And we've covered in previous videos what structures might be involved, what symptoms you might find, and different tips on how to help those symptoms with sitting and lying. We've also discussed why the menopause might be something that may lead you on to having a more likelihood or a higher likelihood of getting this sort of these sort of problems. What I want to talk about today is about exercises that you can do. We've talked a lot about exercises that might not be ideal, like stretching, but we're going to talk about exercises that are good. What I'm not going to do is start giving a list of exercises and start demonstrating those. And the reason being is that every individual that we see in front of us doesn't get the same recipe of exercises. There's lots of reasons for this. This is due to how severe symptoms are. So if you start at a level that's too high and too difficult to do, it can actually flare symptoms. Sometimes that we need to start at a high level and not the first level. And if you started at that first level, that would be too easy, and it's then not going to change your symptoms for the better. We also need to make sure what's going on with your general health. So when we talked about the menopause, for example, we were talking about how you may have to consider having longer rest periods in between those exercises, or that you might have to take longer over a longer period of time to get to that level of strength that you would need to help. So we also consider what else is going on in your body, so whether there are other body parts that you have any issues with, and that again may determine which exercises we give you. So you would need to see a professional, and that professional, such as a physiotherapist, would be then able to diagnose your problem with an assessment and listen to what you're talking about, and then come up with a rehabilitation program that's just for you. The different types of exercises that make a difference are generally strengthening exercises. This is because when we're looking at a problem on this outside part of our hip, as we discussed in the anatomy and the symptoms, there tends to be a reason behind some of the problems could be a gluteal tendinopathy, so a tendon problem related to your gluteal muscles, which are your buttock muscles as they come and attach onto that outside part of your hip bone. So that tendon problem is a tendinopathy, or a change in the pathology of the tendon. When we look at a healthy tendon, we know that collagen fibres come in nice straight lines, and there's lots of bundles of these nice straight lined collagen fibres in one tendon. When we have a tendinopathy, there's a change in the pathology to some of those fibres in not all of those bundles. It might even only be one. So instead of it all being nice and straight, it becomes a bit more disorganised. And the two school of thoughts as to why strengthening exercises are really important is that they either try and realign those collagen fibres back into that nice straight line again, or more commonly it's thought now that if you can strengthen all of the collagen fibres around the outside and in all of those other bundles, it acts a bit like a splint and looks after those collagen fibres that have a problem, and then your symptoms get easier and you can start doing more because your tendon has become more robust and your muscles have become more strong. So there are different types of strengthening exercises. There are strengthening exercises that you can use weights for. There are strengthening exercises that you can just use your body for. And there's also a type of strengthening exercise where you don't move anywhere. So an example of that is called an isometric exercise, and an isometric exercise is a contraction without a movement. So if you were to sit here and squeeze your bottom muscles as tightly as you possibly can, that is an isometric contraction. That is one option for this problem, but what that does is tend to work lots of muscles globally and not necessarily the ones we're looking at on the outside. So a type of isometric exercise for this problem would be slightly different. These tend to be the exercises that we would go to in the first instance if you were particularly sore, or particularly something that was quite irritable, didn't take very much to make it quite sore, or that soreness lasted for a long time afterwards. They might also be things that we use with people if we found quite a lot of weakness in particular muscles, and they're a good starting point to build up strength. If we then move on to the next type, this next type is talking about using your body weight, so no real equipment, and you can do lots of different types of exercises for that. And you can also add weight, and you can add weight to some of the body weight exercises to make them more difficult, or there may be exercises within a gym setting or with weights that you've got at home that you would be able to add in as well. So the things to take home from this is the most important type of exercise for a gluteal tendinopathy, which is part of the greater trochanteric pain syndrome in most people, is to have a look at strength exercises particularly for your glute muscles, and also to have a look at what level and what type of exercise. That would mean that you would need to see a physiotherapist or a different professional to have a look at that. Thanks very much.